Hello, everyone. Today, we honored to have a true innovator in sports and orthopedic physical therapy, Gina Pongetti Angeletti. Welcome to the show, Gina. We're honored to have you.
Thank you.
So, Gina, thank you. Gina is the visionary behind MedGym, Achieve Orthopedic Rehab Institute Sports Medicine, and Rehab Edge Pro. She has over 2 decades of experience. She's a national and world-renowned physical therapist specialized in biomechanics, performance medicine. She also has background in health communication from Michigan State, and she got her master's degree in physical therapy from Marquette University. Gina work Gina's work has taken her to 2016 Rio and 2020 Tokyo Olympics, where she treated elite athletes. She's a published author and a frequent lecturer and co-authored APTA-approved manual on performing arts medicine. So, Gina, welcome to the show again, and tell me, how did you decide to become a physical therapist?
Oh, a loaded question. So I was a gymnast for 14 years. I had high aspirations of doing elite sports medicine treatment when I graduated. I didn't know which direction I wanted to go, and being a physician was always something I was interested in. I was had the pleasure of being under some amazing physical therapists and sports medicine doctors within gymnastics as well as locally, and I was headed towards sports medicine physician route. And a very dear friend of mine, Elena, was paralyzed in a gymnastics training accident. And through her recovery and process, I realized that I didn't like the one-off figure out a problem, diagnose, and out. Although I'm good at that, we call it the 60-second diagnosis, right? 60 seconds, 5 minutes, 5 hours, and you should be pretty accurate with where your diagnoses are. I went to some of her rehab sessions with her, watched her go through the process, and truly like the relationship aspect of what being a physical therapist offered. So you do the diagnosis, but you also follow them through their story. So I still wanted to do sports medicine aspect of treatment with orthopedics, but not just seeing 60 individual patients a week and saying, here's what's wrong with you, hope somebody else can get you better. I wanted to follow the journey and the process, and hers is an amazing one. She is obviously in a wheelchair, but has 3 children that she birthed, and she has cats, and she has a husband and a wonderful life, and that is not in any small favor overlooked by the PTs, OTs, speech therapists, gait therapists, and everything that she had when she was growing up. So that's kind of what triggered that aspect of medicine for me. I also saw a need in sports medicine for someone to be more caring and proactive versus reactive for the athletes, almost making sure that they have an advocate and someone that stands up from them from a holistic perspective. And I think that physical therapy about 20 years ago was still very much so get a script from the doctor in a reactive perspective. And I think that hopefully I'm one of the change makers within our profession as to holistic care and really having a team-centered approach toward physical therapy for the health and overall well-being of any athlete, no matter what level.
Wow, this is very, very interesting, very inspiring. Gina, so once you graduated, did you know right away you wanted to go into private practice, or what actually inspired you to start your own business?
I did. I actually worked for someone else that had a very small private practice. I did not go straight to corporate, which a lot of people do, the big Health South, Athletico, et cetera, right out of school. Lots of bells and whistles. You get vacations and trips and Con Ed and everything. But I really wanted something that was very community based, and I wanted to be able to treat this profession in this area that I am an expert in, which is performing arts medicine. So gymnastics, dance, et cetera. When I quit gymnastics, I also started doing endurance sports and running. So did Ironman World Championships in Kona, and then started the endurance sports aspect. And those two areas of life or sports specialization. So there's physical therapy, of course, which, as you know, with OT, you do everything, right? You have to do cardiac, you have to do wound care, gait, et cetera. And then there's sports medicine. And then within sports medicine, there are specific sports. And then within those sports, there's preventive, reactive, et cetera. So we are very hyper niched into performing arts and endurance sports medicine. Working for another small practice owner was wonderful, but I had ideas on how I wanted to do an all-inclusive practice practice, being very supportive, welcoming, and if you will, the 1+1 is 3 story, where when two practitioners work together, everybody really does well. Very similar to inpatient, where it's multidisciplinary, multi-professional. In the outpatient world, unfortunately, egos and outpatient go in parallel in plethora, unfortunately, and I wanted to make sure that I was able to host and be the home or the mainstay for people that really wanted to do a team treat approach. We have sports medicine, we have concierging into sports medicine physicians, MRIs, CT scans, diagnostic ultrasounds. We do nutrition, both clinical and non-clinical. We can do sports psychology. We do podiatrists and orthotists. We will send you for specialization for neurodynamic testing, valve testing, recovery, et cetera. And that is all available to everyone that comes, whether you're 62 years old walking a breast cancer research walk, or whether you're legitimately training for the Olympics and in our office 3 days a week. And the starting of the private practice was so that I could be able to have that family-centered atmosphere. I don't know about you, Dimitri, but as an OT and a PT back in the day, when we started, it was that you had to go as a response to an injury or an illness or something that happened. And I really want to view physical therapy as a club that people are proud to be a part of. So you're not injured, your coach isn't bad, your sport isn't bad if you're consistently seeing someone that can make you better from a performance management perspective.
Yeah, that's right. Yeah, that sounds really cool. And I would love to get into more, into your clinic, Achieve Orthopedic Sports and Medicine, before and discuss Rehab Edge Pro and MedGym. So, how long did it take for you to start your own clinic after graduating? How many years?
Right. So I worked for a small clinic for 2 years. Of course, just kind of getting your feet underneath you, figuring out what you like and don't like about how controlling a boss might be, or how grateful someone might be about bringing in referrals. I always view salaries and compensation packages as fourfold, right? So it's what you're just paid to do your job, and then what you might be appreciated later for doing if you show them, and what they appreciate you for in the first place, so that you then are motivated as well. And then whatever that career advancement is, some people want to manage people, some people want to manage programs. You can be the manager of numbers in a clinic if that suits you, but you can also manage programs. And after those 3 years, I really said, I feel like I want to start developing programming that doesn't exist, and a way of referring, which we'll talk later about with bounce back referrals and direct referrals, et cetera. And so I then joined a fabulous company called AccuSport, run by Maria Duchess, who was a fantastic mentor. She allowed between 6 and 8 of us to actually have a piece or a part in our own clinic. She obviously knew what she was doing from a business perspective, so helped that overall. So it became much less daunting for someone like me who didn't have an MBA or go to business school to be able to still manage the clinical quality aspect of things with guidance and support from someone else. The clinics did have some syndesmosis, but they also had some separation, and they also had some symbiotic relationships. And then some of us did baseball and some did performing arts, and some had athletic trainers and some had neuro and vestibular. So it was fantastic. Then that was merged with a larger company called Accelerated. And that is when, in my opinion, I was like, this is not for me in doing something that is larger and corporate. There are mergers and acquisitions. There are dinosaurs, people that just kind of eat the smaller people. And then there are affiliations where someone can own you, but you still get to keep your name. And I think as when we kept our small name, when we were still AccuSport or a smaller clinic, people want that small town feel, that local community. And sometimes when it goes corporate, people like that. They want a Northwestern, or they want a Johns Hopkins or something like that to be affiliated. And there are people that can choose either. And it's very confusing when a clinic says that they are both. So I decided that I did not want to climb the corporate ladder. And then I wanted to, in what I learned in business on what to do and what not to do, how to treat your employees, how not to treat them, how to mentor, how not to, I decided that I wanted to start my own clinic. I call it a choose your own adventure. I am a very large supporter of being an equal opportunity employer with regards to all of the legal aspects of race, gender, creed, seeing anybody that wants to get better. But we are not an equal opportunity provider, meaning that if you would like to do 80% treatment and 20% research, beautiful, Dimitri, we'll have space for you. If somebody else is teaching at a college and wants to be a 70/30, fantastic. If you want to be just a worker bee, you can be on this plan. If you'd like to be manage or start your own program, fantastic. If we find a PT who is a golf expert, we will have a program that starts for them, but we will never start a program without the person there. So our clinic should be a place where anyone and everyone can call home forever, as long as we grow with you and you grow with us. And professionally, I don't know what year you graduated, but back in the day, in the late 90s, early 2000s, it was very much so if you were good at your job, your only way for improvement in both your income and work satisfaction was to manage humans and numbers and to make your organization more money. And we have about 50% of our employees that have titles beyond physical therapists, but they do program development or relationship building with club sports, et cetera. So we offer ways for people to make themselves better and to advance, even if they don't want to manage people, which
Oh,
which gets a lot of, which gets a lot of PTs, and I feel like they leave the profession when they don't want the bureaucracy or the ladder climb. Obviously, as a co-founder of an organization yourself, there are a few of us with a, 0.5% that have an entrepreneurial mindset that are willing to put the risk and the time in. And there are some that want to put a little bit of that in, but still not open their own. I want to be a home for that. And I want to create a structure for that for people that doesn't make you a bad person. But it also doesn't mean that you just have to stay a physical therapist.
no, that's really cool. Honestly, like the way you describe your clinic is it's a perfect place for a physical therapist to work at. Um, and
And
so
you're welcome. I mean, if I happened upon an OT or a speech that would be able to help us with our patients, we are not a virginal just PT clinic. Whatever professions are available to help, but we are also not a stroke specialty, right? So I would never say do that. And if I hired an OT and said that I could feed them patients, I wouldn't be able to do that because that's not what our brand is. Mm, so we're very multidisciplinary in referring out, and we have people on site as it makes sense for our patient population. I could tell you a funny story as we're talking about business development. On a napkin, 2 years into practicing, I was at breakfast and I wrote this circle, and the circle had little shoots out to it. And then I did it again and I wrote it like you're walking in a hallway and there's a center space, and the hallway is a circle, and everybody around has an office that's the outside of the semicircle. So at any point in time, you can go and do a VO2 max test the same day as a sweat test, the same day as a whatever. We unfortunately have not found a money tree to have this wonderful $10 billion building to have this happen, but very similar to like an Olympic Training Center facility, to just be able to provide everything that your client would need, because just working on their ankle without nutrition doesn't work, or just working on their return to sport from an ACL without attacking the sports science and the sports psychology aspect of it also isn't going to make for the full person. And I think that those that are a part of Achieve know that just PT is never an answer for how we get you to your end.
definitely. And I want to talk about Achieve a little bit. Can we talk about early days? How scary was it, right? What marketing techniques did you use back then, right? I'm sure it was very different to what you're doing now. And sorry, and one more question. Like, I just want to kind of combine this. Are you the same office space as when you started, or how many offices have you?
Oh, these are great questions. Okay, so when we first started, it was back in the day, still of responsiveness. So I started in 2012 when my son was 5 months old, and I had a 1.5 and a 3-year-old. So don't advise doing that. However, that's often the time that most people are willing to take risks, because if it fails, Malcolm Gladwell is one of my favorite authors. And when you're talking about outliers, outsiders, all these things, and
I love that book.
at what point in time are you more risk averse versus risk open, and how Bill Gates and Michael Dell and everything, it had to happen at the right time. I think it happened at the right time because I was starting to raise small humans, and I wanted a world that was better for them. And so I had an emotional connection to wanting to start a business that really drove me wanting to make things different. When we started, the marketing in the early 2010s was still very much so physician lunches, marketing meetings, and no offense, since you are a male and I am a female, but it was the tall, strappingly good-looking marketing male that would go in their suit and wow the nurses and the secretaries and get everybody to sit down for a meeting. And the product could be crap, it could be wonderful, it could have been anything, but it was the sales pitch. And I wanted to throw up every time I got in my car after one of those meetings, because what I wanted to say to the doctors was, don't send me because I speak well, don't send to me because your neighbor's neighbor says. I want you to send to me because we know science and we know research and we're doing this the right way. And so we started having lunch and learns, and instead of the physicians being above us and us having to ask them for referrals, it's like asking mom and dad to please support your clinic. I thought that that was crazy. People looked at me like I was nuts. My former partners thought I was crazy. I had eye rolls around business tables that you cannot imagine. And we just started sponsoring from the bottom up. Now, before direct access was a thing, we were doing direct access in a very slightly above legal way. And I'll tell you, so people would come to us for an injury screen, and we would give them a taste of what PT looked like. And then we would send them to a physician of choice. So instead of the physicians and me having to ask these physicians for referrals, but they had to keep everybody happy, I would say, I have a hockey team, a football team, 2 gymnastics organizations. They come to me first. I convince the parents and everybody, do not, unless you're going to the ER and you need 911, please do not go to your primary care physician for orthopedic injuries. Please, if you're having scoliosis, do not just go to your neighbor because they say that they treat. Come to us. Let us see. I'm going to interview your parents. I want to know what kind of personality you have. Do we need to push you or do we need to hold you back? Do you want to drive far? Do you not? Are you willing to put time in? And I will match make you with the best physician. I got to know the physician's assistants, not PAs, but their actual administrative staff. And I would say, Heather, I have a patient for you. And they would put them in, and it became 5 to 10 a week. And then we had this great relationship. And so if you, Dimitri, were to bring your son to me, I would get you in for a physician's appointment tomorrow, an MRI the next day, blood work the 3rd day, you're in my office the 4th day, and these readings are happening on the phone. And physicians will say, well, we don't get paid for them. I said, yes, you do. It's telehealth. Figure it out, or I'll send to somebody else. So with the gymnastics side, kind of straddling over to MedGym, I do this for organizations throughout the country and throughout the world, where we set you up with a team of people in Houston, Los Angeles, Seattle, Tacoma, Washington, wherever you are, where we say, here's 3 good sports psychs, here's 3 good nutritionists, here's 4 places that are willing to do your x-rays and MRIs on a stat basis, even if the doctor says they're not, because now you're a part of our team. So we created this marketing shift. And I want to say that I was one of the first people in the US to be doing it. 2 of my friends, one in New Jersey and one in California, were also doing it as well, because we would always talk about solving. I'm not trying to say that I went to med school and that I know everything, but I know everyone that can help you, that can get us to the best diagnosis. And the issue that I was finding in the early 2010s and even the early 2000s is no one was driving the bus. Back in the 1960s, you had a general practitioner and they would learn everything about you. If you had acid reflux, they want to know. If you stubbed your toe, they wanted to know, because the whole picture. And now people are only going to GPs if they need antibiotics for a cough or something. They don't go there to talk about depression or perimenopause or bone pain or anything. Everybody has specialists and nobody speaks. So we became the center of the sunshine, not because we know best, but because we had the connections to everybody else, or the cogwheel to send. And so the marketing success became very community driven. And that I would send to a doctor and they would get people in right away. And before they even got them in, I knew that they were going to get an MRI ordered. So I would set it up with the place the day after to make sure. And so it was very concierge based. We didn't charge for that, but the time that we spent on that was time that I wasn't spending on some strapping 28-year-old white male selling some luncheon with a doctor, which didn't matter. So our PTs sold themselves, and they sold their knowledge base and their connections, and it legitimately changed the scope of practice. And people looked at me like I had 4 eyes. What do you mean you don't want? Oh, Dr. Smith has only 2 more openings for lunches. I said, I don't want it. If Dr. Smith wants to come to my office, here are 3 diagnoses I'd love to roundtable. Here's what you're going to get out of it. I'll help you write a post-op protocol, but I need you to learn what we do as PTs and OTs to help you get better. And you need to make sure that everybody that's in a boot doesn't just start walking, because that's not how gait works. And so it became an educational shift. A few quick statistics, which I think you'll like, and then I'll get to the building of it. As you said, like, are you in the same location? Back in the day, it was 20% walk-in or return patients and 80% physician-driven referrals. As you know, the 80-20 rule, everyone taught it probably from 1995 till, give or take, 2008, 2010. We were 88% non-physician, 12% physician. So I don't care if you didn't like me as a doctor because I called you out for making a mistake. I don't care if you didn't want to refer to me because I don't take you on a Florida vacation. I want you to refer to us because we know what we're doing. And if you don't, that's okay. I have other physicians that would love for us to channel people to. Of course, with the understanding that they have to be available for my crazy text messages in the morning and at night, and they have to sit in front of MRIs and videotape them, walking them through it so I can be educated and we can all be on the same page. So it was just a really big shift. Now, in the 2020s, now that we have direct access, everything is about advocacy, self-advocacy, right? Everybody needs a mental health advocate. I mean, it's crazy in Europe. My family's from Germany and Italy, so we have this Eastern European where you cannot advertise pharmaceuticals on television because the public is not knowledgeable enough to know if they need a GERD medication or not. In the US, everything is about autonomy. And if Dimitri thinks that he needs an IBS medicine, then he needs to ask his doctor. That's not how it's supposed to work. You're supposed to tell your symptoms and your physician. So because the US is so self-advocate based, now everyone has choices and they don't have to go where their doctor writes them a script. You can take that script pad and go anywhere that you would like to. So your reputation, your ethical billing practices, how you treat your staff, what your word on the street is really matters. And that bottom-up approach, or as I say, we flipped the 80-20. So we made it now that we are 80% non-physician driven. And Rehab Edge, which we'll talk about later, states that. From a growth perspective, we were in a 800 square foot facility. My first clinic was on the second floor of the Darien Sportsplex. Myself, a sports performance specialist, and an awesome chiropractor shared this fabulous space. We had to clean up at the end of every day. Then we moved to our actual own space. We outgrew that because we didn't have turf and places to run. But we went.
Sorry, how many months or years did it take for you to move?
Oh, okay. So the first one was 6 months. The second clinic, which was about 2,000 square feet, was probably for 4 years. Then the third clinic, when I left and went on my own, we kind of went down just a hair to like 1,000 square feet in a physician's office. So I wanted the least amount of risk because I knew that I could get clients, but I didn't want the silent strapping stress of $150,000 a year of rent on my mind. So we made work 1,000 square feet for sports medicine, which is crazy, but we had hallways and outside. And then once I was like, okay, I think we can do this. We are now in a 7,000 square foot, 20-foot high ceiling sports performance center where we had our first 10-year lease and we are on our second, and it's in a strip mall. So people can go to Whole Foods and they can go to Petco and do whatever they want to, but there's space, and we need space because of physical movement. We also need space because if we have 5 PTs going at one time, everyone needs to feel like they're intimately with their PT in a broader area. But when we're not doing one-on-ones, we can also do sports performance and be loud and be crazy.
Yeah, especially because you guys specialize in treating athletes. That you need to have that space. It's a different story when you have a hand therapy clinic, like a lot of overseas have.
Right. Absolutely.
maybe treating geriatric patients, but definitely for sports medicine. But it sounds very impressive. 7,000 square feet. That's a lot of space. And
But it's a lot. I mean, it's 10,000, it's a $12,000 overhead every month just for rent, electric, et cetera. And we don't own it because it's not a standalone building, because that's a whole nother story. Do you spend the $4 million on a building and amortize over 15 years? Is that good? But I also didn't know if I wanted the bigness of one. People fly to Colorado Springs for the OPC because it's amazing. Their staff is amazing. Everybody's wonderful. You can have an Exos facility or an IMG facility. I wanted medium-sized clinics, but parsed out 25 minutes apart, so we could literally own the eliteness of the entire western suburbs of Chicago. We don't go north, not because I don't love the people that live north. It's just that's a whole nother population, and they have their own clinics, maybe someday, but I don't know people enough to know the area, and we will never get involved in a clinic unless we are embedded in the community, and that is so important. I'm at the grocery store and I'm asked about somebody's foot, and I don't mind that because they want somebody within their community to help them. And, we're sponsoring the baseball team that my son was on, but also because it's all my son's friends and we want everybody to feel healthy. Oddly enough, and this is kind of funny, we just lost a contract with a sports organization, but in a really, really good way. We were providing too high a quality, taking too much time on concussions, and return to sport. And we would make them wait, until the end of the day, until we had an actual dedicated hour and a half to see them, as opposed to getting them in the minute that they called, et cetera. So I was upset for about 14 seconds. And then I looked back at our mission. And as this is a business growth podcast, at who do I want to be known as? Who do I want every single one of my staff to be proud to be associated with? And what is our product? And our product is ethical, good treatment. And you can be an adult and advocate for yourself, but these kids need someone besides their parents to advocate for them. I mean, if you can't spell your last name in 38 seconds, you have a concussion, and I will lay down in front of the ice or the football field before you will be returning.
wow, this is great. This is great. A lot what you're preaching. This is really good. So in terms of the early days again, right? How long did it, again, I just a few more questions and I want to move on to
Oh, go. Yep,
current
great.
state of practice. How many months did it take for you to make your first hire when you just started out?
So, I've started twice. So I view my partnership with Maria with Akisport as a soft start, right? Because I had a little bit of a blanket. She was an amazing parachute, if you will, that it wasn't just me and I had ideas. We made our first hire quicker then because we had if we went $100,000 down in order to go $500,000 up, it wasn't all you, right? It wasn't there. So that was pretty quick. I would say that was within 6 months. My first hire was an assistant, not a clinical PTA, but literally physically someone that I could be like, can you please text Dr. Cole this? I need to get this person in with Dr. Smith. I need to get these MRI results to make my efficiency better. My second hire was an actual clinical PT. Um,
Sorry,
right.
assistant was also front office staff, like make appointments, scheduling appointments.
That was that in a yes, she did both. And it became very clear that we needed a separate front office because our next hire was a second PT. And then we needed someone to do full. But remember, that was before Hello Notes and Prompt and Optimus and all these EMRs. We literally had, and I know you know this because you started a company because of this, and the law says we all have to have EMRs, but we had these ugly tan, pull only one drawer open at a time. So every day we had to open up the things and file them and debrief everything and scan and do everything. So it was very much more laborious, the front office position from a HIPAA compliance perspective back then than it is now. And that I think was why front office became mandatory. I will say that I have probably 5 mini TED Talks I could do, and the best one that I could ever give is spend money to make money. And if you think that you can do it all, you can't. And your clients notice if you're stressed and you say you're not stressed because you put the kids to bed at 8 and then you went home and you did more notes and more everything, but it's worth an extra 20 grand a year. Say somebody has 40,000 for front office and you have 2 PTs. if you're doing cost centers, it's like 20 grand a PT. It's well worth that, because if you see just 5 more patients a week, you're making 80,000 more a year, and that you have to hopscotch. Hopscotching should always be staff first, not stress first. And if you have nothing in the bank and you literally are living paycheck to paycheck, then you are not ready to start your own office anyway. So the chiropractor thing, and I'm not going to throw too much hate out, but everyone that comes out of school because they think that they're doctors, they want to start their own clinics because they think that they're able to. And I think the worst thing that any school could ever teach somebody, but unfortunately it's a cycle because it's chiros teaching chiros, so they're only teaching what they know, is that you are ready to start a business without understanding a business. And you having somebody there so that you can provide quality care to do the things that they're not beneath you. Nothing's beneath anybody. Everyone can file something. Everyone can clean a toilet. But if I can make money by seeing patients, why am I going and answering 50 emails that I don't have to? So I think that 6-month hire for me, clinically and front office, they straddled each other pretty quickly to be the same person. Then we needed separation when I had a second clinical staff where we needed a full-time front office. My first front office, though, for those of you starting your office, you need someone that's good at billing, but you need someone that's good at marketing, customer service, reaching out, billing. Will also run an errand for you, pick up the floor mats. I mean, it needs to be someone that kind of is a catch-all. When you get to be like us, where we're 27 to 30 employees, you can have people that are specialists in billing and front office. But that was really important to make sure that first point of contact on the phone with anybody or email was someone that could kind of answer anything.
Gina, that sounds scary. How do you find that jack of all trades? It's getting more.
So I think that, and I am not gender biased, but I think that both youth and age are both amazing. In the middle is interesting, right? So a young person can be taught anything and they can do a little marketing, and they might not be amazing at billing because they don't have 50 years experience, but they can do a little bit of everything. They can post on social, they can join a chamber of commerce, they can do everything. And someone who's, let's say 60, who's been doing this for 30 years, also has all of the experience that most likely they've had to do some of that in their job. Someone who's 45 who thinks maybe that they know more than they know because of some degree or something. Honestly, kind of we love, I love looking at the positives of both bookends in that they both bring you. Now, say you hire someone who's 55 to 60. I mean, that's not far off from me, and they don't do the social media stuff like I don't do. I have a helper that makes it look like I do it. Then you find somebody to parcel out that little piece. And if your young person who's 25 knows customer service and knows how to answer the phones and knows how to be a part and involved in community events, but they don't have the billing experience, you can then parcel out that 10% to being a part of a conglomerate or what have you. But it's very that person that's a little bit of a jack of all trades at first when you're small is super important.
Yeah, I agree
And
with
I
that.
think people's mistakes, I guess now that I go back, my ADD, to your original question is how do you find that person? You don't look for the best front office admin. You look for someone who is maybe has also been a hostess at a restaurant and understands customer service, who has also been maybe on phones at her previous job, maybe at a dental office or something else. So you don't want someone who's been in just the billing side of things for 25 years. You need a little bit of that exposure.
Yeah, makes sense. Makes sense. And thank you for that. And then in the first couple of years, what main challenges did you have?
Well, in the first couple of years, it was still in the day of not direct access. So I'm not sounding like a broken record, but the small fighting against the big, right? So I don't have a Florida house that I can illegally and unethically wine and dine physicians and offer them, boats and vacations and things for referring. So the good ones, the good ethical doctors love us because we love what we're doing. Of course, we say thank you by sending them clients and by doing events and doing things with them, but we aren't big enough to do the wow factor. And to be honest with you, as much as I would love 10 more ACLs a week, because the bottom line to that is $100,000 to $200,000 in profit a year, I don't want those ACLs if it takes losing your soul to get them. So I think the biggest struggle in the beginning was still that you had to suck up to and market to from a please, please, please send me your people. And that was just not okay. So I think the biggest struggle now, if we're flashing forward, is there are two types of people in the world. There are many types, but if we're the whole world is always like Republican, Democrat, or blah, 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 or are you rich or poor or whatever. The two types of people from a PT perspective are, I want big because I need the name. I want a Northwestern, even though the person was hired yesterday. If Northwestern thinks they're amazing, then they're amazing. And I need them to communicate in the same office, which you know as well as I. You could be next to each other, and if you have bad communication skills, it doesn't matter. I'm 45 minutes away from some of my doctors, and we talk almost daily. So that is a misconception, I think, that you have to be within the same practice in order to have good communication. And then the second type of person is the type that wants small and doesn't want big. So for those that want big, I don't know that I will ever win you over unless you happen to come to me or you fail at the big corporate organizations that promise that they can do everything. But I'll take the win on the 50% of people that want small. And the bigger that the big get, there were 28 organizations in Chicago at one point in time. They're narrowed down to 6 major hospital systems in the whole state. Everyone is eating each other and everyone works for everybody and everyone's merging and acquiring. And VCs are owning, window salesmen are trying to tell you how to make profit on productivity. So I think that the bigger that they get, the better for medicine because maybe they're making more money so they can provide more research or people's pockets are getting filled. I don't know. But I think the bigger that they get and the more someone feels like they're just a number, the better that is for those of us that want to start a small practice. And again, not that I'm name dropping for Hello Note or for any of these other organizations, but you can be small and not be as scared anymore because the best part about being a PT and joining a bigger organization is nobody ever has to worry about all the scary stuff, compliance and HIPAA and notes and what if you're sued and audited and everything else. Nowadays, with EMR systems that are really, really good, it makes being small and staying small much less daunting.
Interesting. So I like you. I like this point that you made because generally everybody looks at it the other way, right? When you have a lot of mergers and acquisitions happening around you, right? That means they're able to offer better pay, better benefits because the reimbursement is much higher. So a smaller practice, right?
Well, but is it? But tell me why they're. And now I'm going to quiz you for a second because this is good. Tell me why their reimbursement is much higher. What does that mean? Because if United had
They leverage your business, leverage your patients. They negotiating a better rate because they said, hey, we have so many thousands of patients here. We're able to get a better rate, right? What makes it a lot harder for a small one location or even 2 location practices to negotiate the same rate unless you're able to offer.
Chris, how much? But what's the percentage difference in that? The negotiation is like only an 8 to 10% difference. So
I see. It depends where maybe in Chicago, but I've seen like in New York, it's been
bigger.
significantly, huh? Yeah,
I mean,
like
so
in other places. Yeah.
so for me to if I am doing that poorly as a practice, that 10% of a difference would ruin my practice. I need business coaching, not insurance negotiation. I'm sorry to say, but I mean, there's people that there's a lot of people that do, and there's a lot of people that should not run a business. And you're going to pity party yourself into saying, well, I'm failing because of reimbursement rates. Really? Then change it. Then have cash pay services. Then offer add-ons. Then if someone's paying $71, of course, ethically, you don't want to treat them differently than a Blue Cross that bills better. But it's not my fault what insurance you took. And if I'm only making 3 units worth of treatment, then I will provide you with 3 units worth of care. But if you're Blue Cross and you want to stay for 7 and we can bill for it and it's justified because you had a stroke or you're a gate, then that's fine too. So if you're not thinking out of the box, you're going to fail as a business person. And I am absolutely not saying to not be ethical because that is not it. charging cash pay for baseline testing or for everything else is not unethical. That's called smart. So if you don't know if 10% or 20% of a difference in reimbursement, let's just say for 1/5 of your payers is going to make a difference, and 1/5 of 20% is 4%. So if a 4% gross bottom line changes your business, you need to not own a business. And so it shouldn't, I think that the biggest daunting factor for those coming out of school should be, where are you going to get your referrals? What ethics are you going to hold yourself to forever? And how are you going to make the administration side of your job the easiest that it can possibly be? And if you don't want, I don't want to ever be bothered with admin and legal and all this stuff, great. You don't have to be. Don't invent a note software. Use one somebody else has. Join a legal conglomeration where you pay $5,000 a year to ask all the questions you want from an HR perspective instead of hiring your own for $80,000. So there are ways to get around it that actually, from a small business perspective, are okay. And I think 20 years ago, that was so daunting to people because keeping up with compliance and getting on phone calls and just, I haven't been on a compliance call. I mean, I get updated. Our billing manager is on the calls, but our software systems are doing what they should be doing. And so if you create, I am very successful, but I am not successful because of me. If I were in a room by myself, I would never have been able to create what I did. I'm a really good finder of people that balance out what I don't do. I don't want to do legal. I don't want to do notes. I don't want to do ethical. Jan is the best billing manager. I mean, you have to find those people to balance you, and that makes small business less daunting.
Wow, great advice. Wow, I love that. So in terms of referrals, legal, I think these are definitely concerns of people starting a business, right? I hear this all the time. Oh my God, what if I have an audit, right? How do I get
Yeah.
referrals? So these are some of the things you should consider before starting a practice. So Gina, now I want to talk a little bit about Achieve currently, right? So you have, how many staff members do you have? You said 28.
Yep, we have 28 in total. We have a mix of practicing physical therapists, PT assistant, athletic trainers, techs that are here to just help everything go smoothly. I have a personal assistant tech as well, who is literally doing everything from PE notes to starting group chats with people with the gymnastics coaches and the parents. I mean, it's all little stuff. Front office managers, our non-rev staff. We have a marketing kind of program director, Kayla. She's fantastic. We have a billing manager. We then have a compliance sort of person that helps with claims negotiations, rejections, that kind of thing. And then each of our offices has a front office manager. That obviously is not the back end billing, but everything from customer service to whatever. We don't have marketing people because we market ourselves. We hire people to do our canvas and some posting and things like that, but really those are outsourcing, and most of them are current patients who are helping us just round out what we are. So I consider myself a small business, and that if you want a day off, you literally just have to ask one person and notify another. But we're not so small that we can't handle if someone's on vacation or if we lose a staff member, etc. So
That's a great place to be in. So follow-up questions on this. So you said you have a billing manager, so I'm assuming you have billing in-house. You don't outsource your billing?
Yep, we have billing in-house. We supplement our EMR system with a billing system as well. We have not yet, don't hurt me, progressed to a system that incorporates both. But we've had a lot of growth and challenges with the rest of the business in opportunities that we really wanted to expand on, and we just haven't prioritized the time to have an all-inclusive system. So I think the worst that anybody should have is two systems, which is a notes and a billing system. The best is when you have one that incorporates everything. And then everyone needs the third thing, which is the fabulous Rehab Edge, which is your contact.
I actually can't wait to talk about that one. Just want to finish with Achieve first. So
Ah,
And I'm guessing you're in-network provider or is
We are in network for everything except HMOs, which of course is very difficult to get into, especially in Chicago. We will not talk about the ethics of that unless there's another podcast that will exist.
sorry. So the reason you're not in network HMO because the panels are closed, not because you decided to be in network.
Yeah, yeah. And we are not, unfortunately, the state of Illinois pays less than a cup of coffee for Medicaid to be in network, but we are Medicare, Blue Cross, United Healthcare, Cigna, Aetna. So we take most of the private plans, including state plans. Yes. And there's benefits. There's benefits to that, right? And this is 60 seconds. Otherwise, we're going to go way over on this podcast. But if you take insurance, you have to take insurance. And if they give you $71 a visit, you got to deal with it. And sometimes you're 60% what we call the bad insurances and 40% like Blue Cross and self-pays and everything else. And other times you're 80% blue, your census can vary. The reason to take the insurances that pay nothing is simply because if you have physicians or sports teams that you manage and you say, oh, but we don't take that insurance, then people aren't just going to say, go to Gina, they take everything. So there is a volume side of things. And I don't mean volume like overbooking volume. I mean that we are not a bat of an eyelash to anybody, that no matter what insurance you have, most likely we take it. Can we move to concierge medicine? Sure. Have we thought about having a branch of it? Yes. Next year, most likely, will I be cash pay only, but my office will not be. So they can do 3 times a week with Kimberly, but parcel in myself, you can do a provider based. Sure. There's pluses and minuses to that. Then people think you're a snot for not taking their insurance until I explain to them that I am worth way more than, $70 an hour. So, and some people say they'll hear that and say, well, that's 140,000 a year. No, that's not what we make. We make like $8 in net profit off that. I'm saying that's just what insurance gives. And then people say, well, I work for Boeing or I work for McDonald's. I thought I had great insurance. Well, you may if you get in a car accident. You do not when it comes to PT. So, and the amount, you're doing notes to get people more visits that takes me an hour and a half to do to get me a $64 reimbursement. And it is just not worth my time. And I'm not saying that you are not worth being healthy. I'm saying that the process of that from a business perspective is not worth our time.
Absolutely. Absolutely. I agree with that. Okay. And thank you on that. So, Gina, let's talk about the other two companies that I can't wait to talk about. And we have probably 10 minutes left. So, uh, so can we talk about MedGym? So what is the mission of this company and what are you trying to achieve there or have achieved there?
So MedGym was originally started. So my local clinic treatment is for geographically local people. You can sprain your ankle, you can be a walker, you can be an elite athlete, doesn't matter. But for those throughout the country that needed education, speaking, lectures, going into gymnastics gyms and analyzing mechanics, creating new strength programs. NCAA schools consult me and say, hey, we've had 5 Achilles issues this year. What is the issue? So we'll go in and do equipment testing and we'll look at the athletes. We'll look at their strength program. Does their strength coach know what they're doing or are they used to football? So it's a consulting organization more than anything. Sure. Can you get treated in the states I'm licensed in and can we provide advice? Of course. But really, we're looking at bigger picture education to make PTs better in what they're doing to help other people. The biggest, I think, aspect of it is I was in all 3 of the last Olympics, right? So in Brazil, in the delayed 2020, and then also in Paris. And we're not just doing the treatments, but we're guiding the athletes. So we have a lot of Olympians and elite athletes that pay myself and the people that help me $10,000, $20,000 a year to say, anytime I need you, I'm going to call you. Can you look at my MRIs? Can you give me advice? I need a blood panel. I don't think my GP or nutritionist is reading this right. So it's really just managing the sports performance aspect of their life. And then we have this fabulous continuing ed program, which took me 7 years to do. And we just finished our 10th course. It's 28 credit hours and it's 10, it's $1,000, 28 credit hours, 10 courses, and it gets you fully gymnastic sports medicine certified. So you do the psychology, the culture, the history, how the sport has evolved, the physics of equipment, the arthrokinematics of every joint in the body, upper, lower, and spine diagnoses, hand, concussion, neuro, vestibular, what tape is good, how to stretch, why coaches do things, what the culture of Say Sport has brought everywhere. So at the end of it, if you would like to see gymnasts and treat gymnasts in your office, it will make you a better provider. Um, and that is one of my life's biggest accomplishments. It's kind of like a midlife crisis where you think, "Oh my gosh, I have all this knowledge and I need to get it out." And now it's out for certification. So through MedGym, we're also doing a baseline testing program, which we are currently in the literal physical development of, so that we can do strength, flexibility, explosive leg power, et cetera, and we can predict injuries and we can retest you to see if you're moving from this level of gymnastics to this one, you need this shoulder flexibility versus what some book tells you that you need. So that's going to launch in August or September, which is also going to be amazing. Football, basketball, all the revenue sports, they're well above us because these colleges have, they hire all strength coaches and level head coaches and everything, and non-revenue sports are just a little bit behind in that. So that's MedGym, and any and all progress to it and wherever it goes is based on often demand. So if someone says, I really need you to come and look at why my 12-year-olds are having femoral stress fractures, I say, let's start a research study on it. And we do. So it's really just for performance and progression in the sport from a sports science perspective.
Interesting. And how do you market this company at all?
Social media, I mean, yes, but we're so full right now without even marketing, which is blessed that we don't really need to do a lot of it. So we're marketing it to healthcare professionals through Allied Health. Cindy and Tom are the most amazing humans. If anybody wants to do their own continuing ed courses, I cannot speak more highly of them for OT, speech, and PT in all 50 states. And they're the host, right? So marketing it to licensed professionals, but also just on social media. I would love the parent of any gymnast to say, hey, my daughter is going to this PT, and for them to say that you're PT, you need to take this course so you can treat my gym better.
Okay.
Yeah, yeah,
Very
it's
interesting.
a
And
secret that everyone should know about. But we're certifying. We have in the full certification, which also is a case study and an interview with me, which is not easy, and everything, plus exams at the end of every single and like true exams, not just like were you alive during the presentation exam. It is we have between 50 and 100 people that are already fully certified, and it just started a year ago. So
wow.
um, it's really successful.
And how long is the program?
28 credit hours. So 10 courses split into chunks of hour and a half to 5-hour classes, depending on what it is. And medgym.net is where you can find all the information for that as well.
Nice. Okay, very good. And Rehab Edge Pro. So tell me
Yeah,
this.
well, that is a labor of love. So back in the day when, and this is to all the small business owners out there that think that they can do this, you have to know what you're made of. Not you personally, what you're made of, grit. I'm talking what you're made of. Like, who are your patients? How many football players do you have? How many men do you have? How many women? How many 50 and up demographics? And most note systems are like, did you find out about me through social media versus friend and family versus whatever, and nobody goes deeper than that, and nobody is doing parallel demographics. So you were from Dr. Smith, but also you are a part of these 5 organizations which are pre-entered, and you tell the system how much money you've spent on marketing, and it tells you how much per person per capita. Like, it's very, very in depth, and we are very close to getting full plugins for top 10 to 15 major electronic medical record systems, so that whether the EMR system wants it or not, we'll be able to plug in and share data. And hopefully there will be an EMR system someday that will just want to purchase us and negate the fact that this can be individually used, which is our goal. But it tells you what you're made of so that you know who to market to and who not to, and if the time and energy that you're putting into marketing is actually working.
Interesting. So like you're working on API integrations right now for all the
Yes.
apps.
Yep,
Okay.
it's already done as of last week, so
Wow. Excited.
we're on it. We're on it, and our computer programmer and developer is actually a former gymnast of mine, so it's really neat to just see the community of people and what Achieve has created to try to help others.
Yeah. Yeah. How many people on that team?
6 on that team right now.
Nice. Okay. Congrats. So that's actually exciting. That sounds really a cool product, and I can't wait to talk more about it. Uh, once we finish the podcast. And Gina, I guess my last question, a few last questions. I forgot to ask for you. So, what monthly reports? Can you tell me top five reports that you run on a monthly basis for
Ooh.
Achieve?
Top five. So, new patients and physician referrals. So we run through Rehab Edge. We run what are new. So if we see a trend that we're getting 5 from this cheer organization or 6 from this doctor, that's kind of a layup. We definitely run insurance differentiation. So we want to know if we're 60% Blue Cross, 20% Cigna, 30% Aetna, et cetera, which tells us a little bit more about what our bottom line is. We do gross versus net profit. So we definitely run reports of where all of what we think are our stable costs are. So things like rent, electricity, et cetera, and where all of that is and where our fluctuating spending is. And then we do productivity reports for each of our therapists so that we know how close they are. They could be very busy from 3 to 8, but in the mornings have some white spaces or some blanks. And then they're so stressed out, but yet they're only seeing 10 patients a day. And of course, the more therapists per location, the more amortized your overhead. So we're looking at individual cost centers of the PTs as well, because we want you to work smarter, not harder. I don't want you to see 16 patients a day. I want you to see less. But if everyone's referring into our cash pay and add-on services, that obviously helps.
Wow, really cool. Thank you. Thank you for
Yeah,
sharing. This is
I
important.
appreciate it, Dimitri. Thank you so much for the opportunity. And the podcast is great. I hope that everyone who is looking to start a small business understands that it is definitely an undertaking, but not impossible as long as you have the right people on your team around you. And you never say I, you always say we. And if you don't have people to surround you with a we, then don't do your business. So,
Great points. Thank you. Thank you, Gina. And love to continue talking, but we have to end it.
absolutely.
Appreciate you joining and would love to stay in touch and learn, how far you take your companies.
Yes.
All right.
Thank you, Dimitri, so much. I appreciate it. Have a good day. And to everyone out there, good luck with your adventures. You can do it.
All right, Gina. Very good.